closed pod recruiting tips. This is the third of a series of webinars we are presenting for local public health officials and others who care about public health. Today we have two experts experienced in building closed pod networks, and after a bit of housekeeping, we'll get started. We welcome questions, so if you have a question, use the box on the right of the screen to ask it. We will get to as many as we can. If we don't get to all the questions with answers, we will be sending out unanswered questions with those answers several days. We will also be providing you with copies of the slides you'll be seeing, along with an updated workbook from Seattle-King County, which I'm sure you'll find helpful. We have two brief surveys today. One will be made available in moments, and another that follows a webinar. And I encourage you to participate in both of them, including offering your suggestions for future topics and speakers. These are trying times for public health officials, as we know. The serious threat of Ebola is a recent memory, and many of us are similarly concerned about the potential this summer of a pandemic from either Zika, Lassa fever, or chikungunya. A helpful tool for meeting our public health responsibilities is a network of closed points of dispensing. Before we start, though, we have this one question poll, which you're seeing now. What is the biggest impediment to recruiting new closed pods in your community? If you would please take a moment and pick the one that makes the most sense for you. We'll be reporting the results in just a moment. I'll give you about 30 seconds to do that. So please answer that question. What is the biggest impediment to recruiting new closed pods in your community? So we'll probably have some more answers, but I'm going to go ahead and read these results, which are very interesting. By far, the leading result, almost 40%, is the second one, resistance from companies to joining this program. And then at about 25%, no time to recruit pods, not as important as other projects, followed by my jurisdiction needs to develop a closed pod program first, and that's at 15%. There are others at about 12 and 9%. They don't know where to start. So those are very interesting. So I'm sure our speakers will address some of those questions, which is why we asked them at the beginning. Our first speaker is Harlan Dolgen, President and co-founder of Biodefense Network. He is an attorney and a certified business continuity professional and joined me in co-founding Biodefense Network 5 years ago. Since then, he has worked full-time for the firm, specializing in all aspects of closed pods and volunteer recruitment for public health departments around the country. He has been an adjunct assistant professor for community health at St. Louis University's College for Public Health and Social Justice since 2009. Prior to his business continuity and disaster recovery career, Harlan practiced law and trial law for 8 years. He has maintained his law license with the state of Missouri since 1986. He is my business partner and my good friend. Harlan, take it away.
Okay, thank you very much, Dave. Here's today's agenda. We're going to be going into recruitment and the why. The why will just take a minute. I think most people know the why of why you have to recruit or why you might want to recruit closed pods, and then I'll spend most of my time talking about the how. Nick Solari is going to also be with us from Seattle-King County. He's going to be talking about how he manages his pods, which he calls private medication centers in Seattle-King County. Talk about whole community dispensing strategies, the training curriculum he employs, additional technical assistance for pods, and then next steps that he intends on completing with his pods. So first of all, we're going to talk about, for my segment, which is only going to take about 15 minutes, maybe less, we're going to talk about why closed pods are important. You guys know, I assume, about the 48 hours that the CDC has, 48 hours to dispense to your entire population. What you may not know, we've started talking about it, but I don't know if the word has gotten out to everyone, that there's a study by St. Louis University on open pods. It was published in the Health Security Journal in 2015. Just for full disclosure, David and I are listed as authors of that. We didn't actually write the study. We participated early on in helping them develop the questions to be asked. We also helped with our distribution list, and they had about 1,000 people, almost 1,000 people that they interviewed, about 500 from CRI communities and about 500 from non-CRI communities. And what they found I thought was very interesting. So less than half, about 46% of the study participants did have an alternate dispensing modality to open pods. What that means is that about 56% did not have, they are just using open pods. So a little bit less than half are using other things other than open pods to distribute during a bioterrorism event. They also found that fewer than half, which in this instance was about 42%, reported having adequate staffing. So staffing for your open pods is a major concern, and most communities think they don't have enough staff and staffing, including volunteers, to actually run all the open pods that is in their written plan now to do. And so that's where closed pods, that's why closed pods are so important, because the open pod system would be overwhelmed, in our opinion, fairly quickly in most communities, not in all communities, but most communities. And then the CDC guidance, we saw this a couple of years ago and haven't really seen it since, but they were recommending 20% coverage by closed pods. That's a number that we certainly would recommend as well, and just wanted you to be aware of it in case you hadn't seen that. Now, one of the things that we want to talk about a little bit is what happened in St. Louis County, what they could do before their closed pod expansion and what they were able to do after the closed pod expansion. And first of all, let me just level set the conversation by identifying exactly what we did for St. Louis County, and then you'll see how this slide really had an impact. So St. Louis County has 1 million population, which makes the numbers really easy. They had about 27% of their closed pod, of their population covered by closed pods in 2010. That was the largest employer, the largest university, the hospitals, and the first responders made up 270,000 out of the 1 million. They knew from 2009 when they were doing the H1N1 vaccinations that that wasn't going to be sufficient, that they needed to really expand their closed pod coverage. So we responded to an RFP, won the RFP. It was to increase by 70,000 their closed pod population. We asked them for a stretch goal. They said if we could get them to 50% or 500,000 total, so the 70,000 got them up to 340,000. If they could get up to 500,000, they would be very happy with that and felt that their open pod system then could deal with the rest, the remaining 500,000 part of the population. So we, within 5 weeks, we got them up to 720,000 people covered by closed pods. We got 15 of the 19 largest employers to participate in that. The reason that I bring that up is because the impact on their plan for open pods was significantly impacted. So you can see the third line where they were before closed pod expansion, they were going to be planning on 15 to 20 open pods that they knew that they would have trouble staffing, but that was what was in their plan. And after the expansion, they now can plan on 7 to 8 pods, and they have a high level of confidence that they can staff it with both staff from the county health department and volunteers. If you can see, the fourth line is how many staff were needed. Before the expansion, they were planning on about 200 people per pod, which was 100 per shift with 2 shifts for a couple of days. And now they think they need around 1,500 volunteers, staff and volunteers. So that's obviously a significant reduction in their dependence on staff and volunteers, and that was because of their closed pod expansion. So that's another big why, is why you can see down below some of the numbers that were actually expanded. But that's a big reason why closed pods are so helpful. So now we get into the how. So this is what most of you are here for. How can you get your closed pods, recruit more closed pods? So first of all, our methodology is that you should set deadlines and goals. So you should identify how large you want your closed pod network to be, and it's going to be different for every community. It depends on where you start from. And you want to set discrete deadlines. If you just have a project that goes on forever, I'll tell you, one of the issues with St. Louis County was it took them 18 months to get their first closed pod, the largest business in St. Louis County, signed up as an official closed pod. It took them 18 months. If you have deadlines, hopefully you can fast track that and it won't take so long. Our projects usually take 4 to 5 months, just as a guide. You want to obviously research and identify your largest employers. And since you're in your own communities, that should be pretty easy for you all, hopefully. You want to identify internal champions, and I'm going to talk about that in length at the next slide, so I'm going to skip that for now. You want to make sure you have a notice of intent and memo of understanding. Now, the memo of understanding, most of you may have that already. If you don't, there are examples out there if you search the internet. The notice of intent is something we came up with. It's a way to collect information. So on our notice of intent, it's the location where they hope to be a closed pod, because keep in mind this is not an official document, at least the way we draft it. So it's the location for the closed pod, it's 3 contacts with all their contact information, and it's how many people they would expect to cover. It could be employees, it could also be others. You know, if it's a school, it could be students. If it's a university or a college, if it's a hospital, it would be patients. If it's a long-term care facility, it would be also patients or residents. So that's just our way of collecting information from the people up front. And then we always have a kickoff meeting, and we'll go into that also a little bit later. But that's a way of getting people involved in a community effort, and they see other people who are there. So we recommend doing a kickoff meeting where everybody is present. They hear a presentation from you all. They are able to ask questions. Everybody hears the answers to the questions, and everybody thinks that they're all kind of in this together. So we find that to be a pretty effective methodology. And the other thing that is important is, and it's something that you guys don't always have time to do, which I know time is the real factor for this. In fact, that's what the poll showed, is to follow up pretty frequently and to be persistent. So, you know, if you can, you should be talking, nudging these people like every couple of weeks throughout the project. If the project has goals and deadlines, then you're trying to move everybody in the same direction fairly quickly within a number of months, not years. And so you want to be persistent and remind them, because this will never really be at the top of their to-do list. You know, in these companies, whoever the champion is, it's not necessarily the top of their to-do list, so you have to keep bringing it up to the front and reminding them to do it. So I mentioned champions. So to me, a champion is a person in the organization that is worried about health safety, worried about business continuity. You can see the people that we've listed there. So human resources is a good place. Risk managers or business continuity people, employee health and safety. You don't want to just go to somebody at the C-suite, you know, at the C-level, because you know them, because it's probably not in their job description, and so they're not going to be as invested in it as some of these other people. So the other thing is to engage your partners. How can you do this? I've listed this pretty much from the least likely methodology or the least successful methodology to the most successful methodology, in my opinion. So you could try and email people and try and get them involved and engaged through emails. You can do cold calls. That's the most timely, it takes the most amount of time to do that. So that's a somewhat difficult one. But if you can reach people through cold calls, if you don't have any connections at all, then you can do that. One-on-one meetings are a pretty effective way, because if you're meeting with them in person, hopefully you can engage them, and you have to have the right person. If it's the right champion within a company, then a one-on-one meeting is actually a pretty good methodology. And then kickoff meetings. So that's where the entire community is invited to an event. You set it a month out as part of your planning process, and then you invite a number of companies to try and figure out who the champion is in those companies to invite them to the kickoff meeting. And the one note at the bottom, whatever method you choose, be persistent. That is important. The tip on the right would be helpful. Sometimes you can find local workshops for business continuity people. There are meetings in some communities. This would have to be medium to large size communities where business continuity people gather and network and maybe hear presentations from speakers. So if you can do something like that, or at an LETC meeting, if you can get on the agenda for them and you can announce your program, you might be very successful at recruiting closed pods from doing that. Another thing you should have is executive support. So this is an example of St. Louis County. The top executive in St. Louis County wrote us a letter of support specifically for this program. We were able to share it with businesses, and that gives it a lot more credibility. So the advantages, I'm not going to go over the top half too much because I'm running short on time, but let me just deal with the bottom part. To me, if you can establish relationships with the largest employers in your community, that has benefits way beyond closed pods. It has benefits because you can get them involved in other programs. So if you have other public health programs like smoking cessation or asthma or diabetes programs, a flu clinic that you want them to participate in, you now have the relationships and you can start working on other things. So when you get a closed pod relationship, hopefully it'll benefit you in many other ways. And the last slide for me, I would say, first of all, be kind of cozy up to your legal department. You're going to be dealing with them not only with the MOU template, but also with if a company requests, subtle changes to your MOU in order for them to sign it, you'll be going back to your legal department again and again. So you just want to make sure you have a good relationship with them. Make sure before you, as part of your planning process, you want to make sure you have all the materials available up front at the very beginning. It's been frustrating a couple of times when we start recruiting for a company, they have an MOU template that they are getting approved. It's in the approval process for a month or two because the lawyers have it maybe and they're not responsive as much as we'd like. And that's another thing why it's good to cozy up to your legal department. But so just make sure that you have all your materials ready. If you're going to make anything put anything on the website, whether it's a blurb or a whole page on what closed pods are, you should do that up front. Know your requirements. So are you going to limit, if you're a medium to large size community, we recommend like 500 people or more as part of a closed pod. In other words, it has to be impactful. You don't want too many 50-person closed pods because it takes as much time and energy to train and to operate a 50-person closed pod as it does a 500-person closed pod. So you want to make sure you set appropriate limits. If you're in small communities, we recommend 100 employees or more. If you're in large communities, medium to large size communities, 500 employees, and we've even seen as high as 1,500 employees or more as a lower limit. And then deal with the costs and liability concerns up front. Make sure that they know, we repeat it very often, that there's no cost for this, no cost even for the medicine, we always say that, and that there are no liability concerns because of the PrEP Act. I would assume you're all familiar with the PrEP Act. If you want more information on that, you can contact me and I can give you some more information. And then lastly, have a plan for follow-up. You don't have to have dates for training and exercises when you first start this, but you should know that if you're recruiting in the springtime, that maybe in the fall you're going to be setting up training and exercises because they're going to want to know that. That's one of the questions that you'll get, so it's ideal to have a good idea on just when you're going to be doing this approximately, not that you have specific dates. And the distribution strategy, some people call it an alpha pod, some people call it a local distribution site. You just need to know how you have to have your plan worked out as far as, are you going to ask people to pick things up from you pick up the medicine, or are you going to deliver the medicine to all of the pods themselves? So you just have to figure out how you're going to do that. And with that, Dave, you want to introduce Nick?
Sure. Thanks, Harlan. Appreciate it. Nick Solari is the Emergency Response Planner for Public Health, Seattle, King County, Washington. In that position, Nick provides expert-level support and improves the department's readiness to mobilize its emergency response capabilities. He serves as planning lead for medical countermeasures and supports other planning leads by contributing operational detail to additional ESS 8 plans. Part of this planning process includes growing the regional network of private medication centers to serve as closed pods for their covered populations. Nick holds a Master of Public Administration and a Bachelor of Arts in Political Science from the University of Georgia, and completed a year of service as an AmeriCorps Vista in New Orleans, Louisiana. So I grew up in Florida, and I know how these Georgians talk. So I'm going to introduce Nick by asking him, how about them dogs? Nick?
Well, I appreciate that call out, although you'll hear I don't really have a Southern accent. But thank you so much, Dave, for the introduction, and thank you, Harlan, for your previous work on those slides. And good afternoon or good morning to all of you, depending on where you are. So as Dave said, my name is Nick Solari. I am an emergency response planner with Public Health Seattle and King County. I'm happy to have the opportunity to present to all of you today on how you can best manage your closed pod network. Here in Seattle and King County, closed pods are an important part of our medical countermeasures operations. And I hope that the information presented here today will help you in some way advance your own closed pod programs. So just a quick overview of what I'll be presenting on today. First, I'd like to cover our whole community dispensing strategy and explain where closed pods fit into that strategy, referring back to some of the ideas presented earlier by Harlan, showing you how that works here in our community. And next, I'll be talking about our training curriculum that we deliver to our partners so that they can begin to develop and write their dispensing plans. I'll also quickly talk about what are some other services and technical assistance we offer our partners beyond that initial training. And then finally, I'll wrap up by talking about the direction of our closed pod network and where we see it going from here. And let's see here. Bear with me one moment, folks. Looks like we are good to go. Okay, so to show you how we envision a mass dispensing operation unfolding in Seattle and King County, we divide our points of dispensing into two segments, and I think I actually went back too far. There we go. So we divide our points of dispensing into two segments, public medication centers and private medication centers. Public medication centers are locations open to all, and they include independent and retail pharmacies. They also include your quote-unquote traditional open pods run by public health that would be stood up in just in time at community centers or clinics. Going back to the independent and retail pharmacies, since H1N1, we've worked here with the Washington State Department of Health and the Washington State Pharmacy Association to really bring pharmacies into our dispensing operations, and we're proud to say that most large pharmacy chains actually in Washington have signed an MOU agreeing to assist us during a public health emergency. Again, those are chains, possibly independent pharmacies that are private, but again, they would be open to everyone in an emergency. So we consider those public medication centers just not your traditional, again, quote-unquote, open pods that are at your community centers and clinics run by public health. Now, for our private medication centers, they serve our closed populations, and they usually target employees and their families, or patients and clients and their families. So our healthcare agencies are a big part of this. Healthcare agencies include hospitals and long-term care. We also include government agencies, first responders, and large employers in this list as well. So the graphic that you see here, this pyramid, depicts how we think of mass dispensing operations here in Seattle and King County. So in an ideal world, we first leverage our healthcare infrastructure, our healthcare providers, and our pharmacies to dispense medications. So we'd like to see them carry out the bulk of our dispensing operations. Again, pharmacies are especially important to us as many residents live very close to pharmacies. They already know where they are. They potentially even have a relationship with their local pharmacists. So once we move beyond healthcare providers and pharmacies, the next thing that we hope to leverage are our closed pods to dispense medications. And finally, again, those quote-unquote traditional public health open pods, and we'd really like to see those reserved just for our most vulnerable populations. In Seattle and King County, we've long recognized that it would be impossible for us to dispense medications using only open pods, so that's why we've shifted our model away from that, kind of what Harlan was talking about earlier. How do we reduce our dependency on those public health run open pods? And so we're continuing to try to attempt to use alternate dispensing modalities to serve our populations. We estimate that about 40% of our population currently would not be served by healthcare, pharmacies, and or our closed pods. So we're trying to get that percentage down even further. And when we think about our large employers as a part of our closed pods, so far we have agreements with a handful of large employers here in Seattle and King County that cover a little over 300,000 individuals, and that's about 15% of our population. So once we get a large employer on board, and Harlan talked about the recruitment process, so I'm going to skip over that, we'd like to talk to you about what next steps we take once we get them to sign that MOU. So they sign an enrollment form or an MOU with us, and then we set up and deliver an in-person training to help them begin to write their dispensing plans. We found that the training takes around 3 hours, and it's really designed to be a discussion to help answer questions and think through some of the tougher parts of writing a plan. It's important to remember that our large employers aren't necessarily well versed in emergency preparedness planning and operations, so we are really there to help guide them through this plan writing process. We also leave them with a planning workbook that we've developed so that they can continue to work through their plans after the training. And that planning workbook actually will be made available to all of you after this presentation. We'll be emailing that out, and we offer that freely to everyone, so please feel free to use it and adopt it for your own communities. Got it. So planning workshop overview, and the sections that you're going to see here actually, again, they follow this planning workbook that I'm talking about. So I'll quickly walk you through the training that we deliver. And you'll also see, I hope, that really as a part of this workshop, we really want to make sure that we're focusing on making plans operational for our large employers and our closed pod partners. So the first section we cover with our employers is appointing a planning committee, asking them to think about who should serve on this committee as they begin to formalize their plans. We encourage employers to include representatives from HR, legal, communications, facilities and maintenance, and even executives on their planning committee, so obtaining that buy-in as they begin to write their dispensing plans. Next, what we do is we help the employer define their covered population, meaning the people that they want to dispense medications to. This usually includes employees and family members, and in Seattle and King County, we strongly encourage our large employers to at least cover their employees and family members. Some employers also choose to cover vendors, contractors, interns, volunteers, and that's great too. But because it is their plan, we really leave the decision on who the employers wish to cover entirely in their hands. We also emphasize the need to plan for populations that have access and functional needs, and to think about how those populations might impact other components of the planning process. So for a planning workshop overview, this is our section 3. This is determining staffing and structure. So that's the next section we cover. And really a common question we get from our partners is, how do we know how many staff should work at our dispensing sites, and how do we organize them? So in this section, we do a couple of things. One, we introduce them to the incident command system, just a very brief overview, and explain what we believe are some good rules of thumbs for organizing staff responsibilities and roles. We break down operations into 3 components, so greeters, registration, and dispensers. But again, I want to emphasize that this is the partner's plan, and they have full control over that. So we do try to steer them into what we think are the best ways to organize their staff. But again, this is up to them ultimately. Similarly, we also provide them some algorithms that we found to be true in past exercises at the local level and from data provided at the national level, such as from NACCHO, to help them identify how many staff they need. So we work with them to set some parameters. So again, how many people in that population they wish to cover, how many people they think they need to dispense to per hour, the size of their dispensing site, which I'll talk about in just a second. But once we get those parameters and those variables in place, we work with them to set an optimal staffing number. And again, when we email that workbook out, you'll be able to see an expanded form of what you see here in terms of what we think that algorithm looks like. So after staffing, we then work with our partners to talk with them about how to identify a dispensing site and how to design a floor plan. So we'll brainstorm with them on what facilities may be a good fit for a dispensing site, and all of that entails, meaning layout of the site, parking, making sure that the building, again, can serve people with access and functional needs. We also provide them some model floor plans that we think will help ensure that their queues are orderly and manageable, again, increasing their dispensing throughput times. Sometimes we're also fortunate enough when we do these trainings to present at the actual building where our partners will be conducting their dispensing operations. And so if that's the case, we also try to take a tour of the building with everyone to, again, further help them visualize what dispensing would look like in their facilities. We then briefly touch on security, explaining why a security presence may be needed at their dispensing site and how to consult with security as they write their plans, either security that they already have in their buildings or potentially even local law enforcement. We then move on to probably our longest section, which includes how to actually dispense medications. Again, many of our employers are unfamiliar with sort of dispensing principles and how that process looks like. So we cover everything from the types of medications they may be handing out, Cipro and Doxy, to how they would read a screening form. We also lead them through our online screening tool. We use Dispense Assist, which many of you are probably familiar with. And we also show them examples of a printed medication voucher, and again, an example of what a paper screening form would look like. And in some trainings, we'll actually even quickly simulate the dispensing process. So we'll pull out the trainer bottles, the fake bottles of the Cipro and Doxy to dispense to people. We'll have them peel the labels off the bottles, practice signing the paper forms, just so that they can get a feel of what that would look like, again, if they actually had to activate their dispensing plan. So we do a mini drill sometimes with our partners. We'll also show them some examples of the fact sheets that people might get when they're handing those pills out. So finally, we ensure our partners are thinking about how they would communicate with their employees during a time of emergency, and we ask them to consider whether or not they wish to disclose to employees ahead of an incident that they have agreed to serve as a closed pod. We also summarize everything there at the end and leave them with some things to work on. And so those things to work on usually include those planning variables. Again, those planning variables include defining their covered population, determining their staffing structure and their numbers, designing a floor plan, things like that. And then once those variables are knocked out, they can then begin to insert them into their planning framework that we've laid out to them in their workbook. I want to quickly talk about some other activities we do in Seattle and King County beyond that initial training. So we make it a goal of ours to stay in contact with our partners on a quarterly basis, at least checking in with them to see how their planning process is going. And again, we are always available to offer technical assistance where we can. Part of that technical assistance is to also offer individual consults and perform site visits when asked. A popular site visit, actually I'll be doing this tomorrow for one of our large employers, is to go out and actually check check out their facility as a dispensing site, and again, to look at how the flow of visitors would go through their dispensing site and come through their facility during operations. And so that's something that we do with them. And then when a partner is ready, we're also available to help develop and design drills and exercises with them. And so to sort of wrap up, I'll kind of leave you where we think this is going. Again, we want to continue to recruit new partners into the program and cover more of our total population by closed pods rather than open pods, again, realizing that it is more efficient for us to dispense medications through our closed pods rather than those traditional open pods operated by the Public Health Department. We'll continue to train new partners as they come on board using the model that I just described in my previous slides. And eventually we'd like to conduct a functional or large-scale exercise with our closed pods. We did a large-scale exercise with our pharmacies just about a year ago now. But again, that is something that we consider to be a part of our public medication centers because they're open to all. So we haven't yet done an exercise of our private partners, but that's something that we're definitely striving toward. And we think we have a couple in place who are pretty far along with their planning process that we should be able to hopefully get some exercises up and running within this calendar year. An added benefit to all of that, of course, when we do think about doing a training exercise with them, is satisfying a number of those ORR requirements that the CDC has. So with that, that sort of concludes what I had to present on today, and I think Harlan and the Biodefense Network has done as well. So I do believe we'll open it up for some questions. Again, from my end, I'd like to say thank you for participating in this webinar. And with that, I'll pass it back over to the moderators to open the lines up for questions.
Nick, thanks very much. That was interesting, and I'm sure the participants will look forward to getting your workbook that will be sitting out soon. So we have a couple questions, one from Ron Hernandez, who asks, explain how to reach the right person at a corporation. Who is the right person? How do you find their telephone numbers? Harlan, you might be able to answer this. How do you find out who they should reach out to?
Yeah, so let's take just Corporation X. I won't use names, but what I would probably do is call their switchboard and ask if there's someone in charge of employee safety. Ask if they have a business continuity person, and that's the same in government. It's called COOP, Continuity of Operations Planning. On the private sector side, it's called business continuity, sometimes called disaster recovery. But disaster recovery has kind of become more known with data center recovery and not the full program. So the one that is most responsible for protection of employees is business continuity. Sometimes, like if it's a university or college, they may have a health center. And so the head nurse at the health center oftentimes is somebody that would be very interested in this program. So it really depends on for a factory type of place, they probably have an employee safety person. So it really depends on what type of business that you're going into, but you would want to basically look for the person that's responsible for the safety of the employees. That's the person whose ears is going to perk up when you say you have a methodology for helping employees during a bioterrorism event.
Nick, do you have any thoughts you want to add to that?
No, I think that Harlan hit it right on. The folks that we would normally work with are, again, those people who are responsible for continuity of operations, especially for your larger employers. They should have a couple of folks lined up to handle that. And then, again, occupational health as well. Those two, are the places we work with.
Yeah, and I would also add human resources. We found in a number of places that the human resource directors recognize the value of this, and so you might just ask for the Director of Human Resources. For a university, you might also look for the Department of Public Safety. They will probably have some sort of a safety officer. So that's another place to check when you have identified an organization that you want to go after. So I want to go back to the poll for a second, and 39% of the people said, and somebody asked how many people voted. We have a percentage of voting, 83% voted out of about 50, so that's what, about 43% 42 people, and 40% of those people, 4 out of 10, said the main impediment was resistance from companies to joining a closed pod. Nick, have you experienced companies that are resistant to joining a closed pod? And if so, what do you tell them? How do you persuade them that it's smart for them to join the pod, to become a pod?
Sure. So I'd say that it can definitely be a challenge. Sometimes when you do try to identify that champion within the organization, sometimes that person doesn't turn out to be the champion yet you thought he or she would be. So continuing to try to find the right person. And then as a part of that sales pitch, if you will, in our slides we talked about the benefit to public health, right? It's important for us to have closed pods because if we have closed pods, it means we have to operate open pods. However, it's important when you're meeting with employers to sell them on the program as what benefit this will provide to them. So again, continuity of operations is a big one. If you can emphasize to them, hey, if this happens and you are running as a closed pod, you will get your medication sooner. Therefore, your employees will be able to continue their work or return to work sooner rather than having to wait in longer lines at the open pods. We again emphasize to them, like Harlan talked about, there is no cost to the program. We also emphasize to them, again, this idea of liability. So under the PrEP Act, they're covered there. So we try to point out to those folks all of the benefits as to why they should join the program. And at the end of the day, we also emphasize that it is an MOU, meaning that if you sign on to the program, you go through these steps with us. We definitely hope that if called upon, you will activate your dispensing plans and that you'll be able to assist us during an emergency. But, if you decide not to, there's really no obligation. There's no harm, no foul on your end. So we work with them to get them ready to do it, but I think that helps a little bit too. If people feel as though they're not necessarily obligated to do this, I think that helps with getting them on board too. And then we can kind of introduce them to the topics of how do you plan, kind of show them how easy we can help make it be for them.
Thanks, Nick. So Eloise Hazelwood asked a question. Do the private partners, non-medical, require medical oversight to dispense the meds through their employees?
This is Nick from King County. No, from our end. So when we're talking about these plans right now, where we're in the planning process of is we're just talking about pills. We're not talking about vaccines. We haven't crossed that bridge yet. But when we're talking about dispensing pills, they don't necessarily need to have a registered nurse or someone like that dispensing those pills at their sites. The sort of marching orders come from public health for sure. So if they're working with us, again, that's why we consider them covered under that PrEP Act, because they're getting instructions from public health. We're certainly maintaining contact with them through dispensing operations, but we try to pitch the program and give them the tools that their everyday employees and workers would be able to carry out this operation without medical professionals actually on site. I'll say one more thing. If they needed to call medical professionals, we would have a hotline available either here in Seattle and King County or through the CDC. So if medical consult is needed, if you're operating, you have someone come through and you start operating outside the bounds of Cipro and Doxy and you're not sure what to dispense to someone, we make it very clear that there would be medical consult available off-site.
Yeah, if I can answer that, this is Harlan. If I can answer that in kind of a more general or generic sense, it really depends state by state on whether medical oversight is required and how detailed the medical oversight has to be. So if that question was asked by a county or city health official, you have to check in your state to see. So Nick answered it for Seattle. I can tell you across the country, we've got models that run the gamut from strict medical oversight to no medical oversight at all, as far as what the state requires.
Thanks, Harlan. Nick, there's another question for you, and I think this may be the last question we can answer, although we do have others, and we'll get those out to everyone. Question for Nick from Andrew Cox. How do they, meaning you, direct people to the pharmacies without them getting overwhelmed? You talked about sending people to pharmacies. Do you have some system of controlling how many people are going to be going to the pharmacies?
Yeah, absolutely. So that's a great question. I don't know, and I'll say that because you know, it's obviously something that hasn't been tested real world. I will say, however, that we have a significant number of retail chain pharmacies here in Washington State, so much so that we can cover, again, this is Washington State, not even in just Seattle and King County, but in Washington State, we can currently cover 85% of the population live within 5 miles of one of these pharmacies that have signed on to this MOU to dispense to us in an emergency situation. So hopefully the idea is that it's not just your one pharmacy in your neighborhood that's serving, it's all of the pharmacies in the neighborhood, and we've kind of reached this critical mass point where, you know, a couple of them were saying, well, you know, if X pharmacy doesn't sign on, I don't know how it would look if we sign on. And we've kind of gotten past that now to, again, 85% of the population in Washington State lives within 5 miles of one of these pharmacies that would open. So I guess to answer your question, I don't know what it would look like if these pharmacies would be overwhelmed. I can certainly understand the skepticism, but we are trying to make it so that all of the pharmacies could come on board. And if we tackle the dispensing sort of operations from, hey, we have our healthcare agencies, we have our pharmacies, we have our private employers, we have these open pods, if we can do all sort of 4 or 5 of those different modalities, hopefully we can reduce the stress on the system so that it's spread out across all modalities and not focused just on pharmacies.
Thanks, Nick. So we have several other questions, and as I promised, we will be sending those questions with their answers out to everyone. I do want to read one more comment. Hi, Nick. Nice job. Great webinar. We miss you in Massachusetts. That's Lisa Crowley.
Well,
so
thank you.
We have a fan in that. So thank you all for participating. We do have another poll that you'll be seeing in just a moment. Your responses will be appreciated to help us plan for future webinars, and I encourage you to answer those questions. And finally, if any of you plan to attend the Public Health Preparedness Summit in Dallas next month, we hope you'll stop by our booth, booth 411, and say hello. This concludes today's webinar. Thank you all very much for participating, and we look forward to hearing from you and chatting with you at future webinars. Good day, everyone.
Thanks, everyone.